As Medicaid funding becomes more uncertain, donors play an essential role in keeping our doors open. Your support allows us to continue providing life-changing, accessible care to youth who would otherwise go without. So a lot of people tell me they just actually don't know how Medicaid works, but anyone who's ever had health insurance knows how necessary it is to be able to see a doctor, get medications, stay healthy. Medicaid is simply basic health insurance that is jointly funded by the federal and the state government. And it allows us to give access to healthcare to the most vulnerable members of our communities. So there's a common misconception that people on Medicaid are taking advantage of taxpayers, right? But it's just not true. Most Medicaid recipients actually work full-time and pay taxes, but their household income just can't stretch to cover rent, heat, transportation, the utilities, and get healthcare. Medicaid helps fill that gap so families don't have to choose between a doctor's visit and keeping the lights on. And let's remember, over 1/3 of Medicaid enrollees in Michigan are children. These are kids who would have no access to medical or behavioral health care without Medicaid. Access to health care is a building block of a functioning society, as essential as education and safe housing. Medicaid helps provide that foundation. And even if you don't use Medicaid yourself, you still benefit from it. Medicaid dollars help support school health clinics, emergency departments, community health programs, and local clinics. And when Medicaid funding is cut, hospitals and clinics are forced to reduce staff, which results in job losses in the community and decreased access to care for everyone. In Michigan, school-based health centers depend on Medicaid funding just to keep the doors open. At the Corner Health Center, which is really the OG for school health in Michigan, Medicaid cuts could mean that we can't staff our clinics or provide the level of care that students and other young people deserve. The Corner provides medical care, behavioral health, and health education to more than 10,000 people annually. The majority of our patients rely on Medicaid, and our school health programming depends on it. Your support allows us to continue providing life-changing, accessible care to youth who would otherwise go without. Now more than ever, philanthropy bridges that gap, ensuring that every young person who walks through our doors receives the care, respect, and support that they deserve.